This module will focus on quality improvement within EMS systems. Once completed with this module, you should be able to define quality improvement in the EMS environment and describe the contribution of continuous quality improvement to EMS. Before we delve too deeply into quality improvement within EMS, it may be prudent to first define just what quality is within an EMS setting. The Merriam-Webster Dictionary defines quality within the appropriate context as a degree of excellence or superiority in kind. Within a healthcare field, such as emergency medicine, however, this definition is somewhat lacking. Luckily, the Institute of Medicine has defined quality of healthcare for us as the degree to which health services for individuals and patient populations increase the likelihood of desirable health outcomes and are consistent with current professional knowledge. With this Institute of Medicine definition in mind, our definition of quality in EMS could simply be the application of current professional knowledge in emergency medicine to improve patient outcomes. If quality in EMS relates to patient outcomes, then quality improvement efforts would obviously seek to improve those outcomes. So, what are some things that could stand to be improved in EMS that directly impact patient outcomes? To answer this question, we will once again refer to the Institute of Medicine, which published a document in 1999 titled "To Err is Human: Building a Safer Health System." The IOM reported at the time that anywhere from 44,000 to 98,000 people die each year in United States hospitals from medical errors that could have been prevented at a cost of anywhere from $17 billion to $29 billion per year in 1999 dollars, which would be the equivalent of up to $43.4 billion in 2018. Within that report, the IOM also recognized four primary types of medical errors. The first type of error was a diagnostic error. There could have been an error or delay in diagnoses. The healthcare provider failed to employ the indicated test, an outmoded test or therapy was used, or the healthcare provider failed to act on the results of the diagnostic monitoring or testing. Within EMS, it is easy to see how some of these errors could occur. Maybe the crew neglected to check the patient's blood sugar, the paramedic misinterpreted the 12-lead EKG, or the AEMT did not want to push a fluid bolus despite the patient's low blood pressure. The second type of error is one in the actual treatment of the patient. The crew could perform an operation, procedure, or test incorrectly. The indicated treatment could be administered negligently. A medication or administration error could occur. Treatment itself could be avoidably delayed, or an inappropriate, not indicated treatment could be administered. While we do not often think of EMS in a preventative role, the third type of medical error is preventative, whereby a prophylactic treatment was not provided where it could or should have been, or there was inadequate monitoring or follow-up of a treatment that was provided. Within the realm of EMS, that could very easily relate to the failure to reassess the patient or provide appropriate follow-up care based upon the results of that reassessment. Lastly, there is a somewhat catch-all category, simply called Other, that recognizes negative events such as communication failures, equipment failures, and other system failures. To dig deeper into this topic, it may be beneficial to visit another resource, NHTSA's A Leadership Guide to Quality Improvement for Emergency Medical Services Systems, published in 1997. This document relied upon the Malcolm Baldrige Quality Program, which was established in 1987 to promote awareness of the importance of quality improvement, recognize organizations that make substantial improvements in products, services, and performance, and foster inter-organizational information sharing on best practices. In 1994, the Baldrige Award launched a special initiative to extend the program into healthcare professions. As part of this Baldrige program, there are 7 key action areas or categories that apply to EMS. Leadership involves efforts by senior leadership and management leading by example to integrate quality improvement into the strategic planning process and throughout the entire organization, while also promoting quality values and quality improvement techniques in work practices. Information and analysis relates to managing and using the data needed for effective quality improvement. Information and proper analysis of data are critical to the success of quality improvement initiatives and activities. Strategic quality planning involves the development of both long and short-term organizational objectives for structural, performance, and outcome quality standards, identifying ways to achieve those objectives, and measuring the effectiveness of the system in achieving quality standards. Human resource development and management applies to the development of the EMS workforce with a focus on ensuring that the entire EMS workforce is motivated to achieve new levels of service and value. EMS process management focuses on the creation and maintenance of high-quality services, even if those related work activities or workflows cross functional groups or departmental boundaries. EMS Systems results requires the assessment of quality results achieved by the organization. Garnering the satisfaction of patients and other stakeholders is also critical in determining the level of quality services provided by an EMS agency. Many of today's quality improvement initiatives have origins in industry, with several philosophies emerging from quality pioneers like W. Edwards Deming, Walter Shewhart, Joseph Juran, and Philip Crosby. Deming viewed quality through a humanistic lens that maintained quality issues are caused not by people but by flaws in the system. Applied to the realm of EMS, Deming's principles would stipulate that EMS can and should be better. Efforts to improve EMS quality should be continuous. Every EMS process can yield data and information on how well the process works, and data and information are essential to improving EMS. The work of Deming eventually gave rise to Shewhart's Plan, Do, Check, Act cycle for quality improvement. Within that context, an EMS agency should plan to implement a change to improve quality or decrease the costs associated with providing services. Once the plan is ready, the agency should enact the plan. After a reasonable period of time, the implementation of the plan should be checked to see if the desired outcomes resulted from the change or if the initiative fell short. Based upon that follow-up evaluation, the agency should then act to either keep and institutionalize the change that led to the positive results or propose further changes to address any shortcomings or other opportunities for improvement. As denoted within the name, this PDCA cycle is indeed a cycle. It is continuous and never-ending. That is the nature of ongoing quality improvement. NHTSA's A Leadership Guide to Quality Improvement took an even closer look at Deming principles and applied his 14 points to transform management practices to EMS. The first need is to create consistency of purpose. This is where the organization's mission, vision, values, and goals come into play. Everyone within the organization should know the purpose of the organization and how it plans to achieve that purpose. For most EMS agencies, it is probably fair to say the highest priority of the organization is to provide the best quality medical care and transport services to the community in a cost-effective manner, or something along those lines. If the EMS agency's organizational statements do not create that unity or consistency of purpose, that is something that needs to be addressed. From this consistency of purpose, everyone working within the agency should find ways to promote quality and efficiency. It is everyone's responsibility to seek opportunities to improve all aspects of the EMS system while promoting excellence and personal accountability. From the organization's leadership on down, pride of workmanship must be instilled and emphasized, with organizational leaders setting an example. As previously mentioned, quality improvement is an ongoing process. Relying upon spot checks or inspections to find problems is inadequate and often too late. Continuous improvements to the system using the PDCA cycle is a much more reliable means of ensuring quality in services offered by an EMS agency. If the EMS agency is purchasing goods or services, it is a dangerous assumption to presume that the cost of an item is indicative of its inherent quality. Vendors and suppliers should be considered partners with the organization, and purchases should be reviewed with quality improvement concepts in mind. While the EMS agency should evaluate its relationships with suppliers of goods and services, that same agency must also remember that it is a supplier of EMS services to the public, and quality is a reasonable expectation of those system users, as well as those who provide financial support for the EMS agency. Be sure to engage your customers to identify opportunities for improvement. It is important for all workers within the organization to understand the need for quality within the organization and the goods and services it produces. This means that every worker within the organization understands the needs of those who use and pay for EMS services, how to meet those needs, and how to improve the agency to meet those needs. This begins with leadership, as effective leaders are thoroughly knowledgeable about the work being done, along with the environment and complexities of the work that impacts the agency's workforce. Effective leaders create and support a culture of learning and quality where everyone is given the opportunity to identify and participate in opportunities for improvement. To foster such a culture, organizational leaders must recognize that errors and failures are opportunities for improvement. If such errors, failures, or concerns are not reported by employees out of fear of reprisal, however, that will undermine the effectiveness of any quality improvement program. By supporting a just culture that approaches issues as not being person-centered but rather indicative of a flaw in the system, EMS providers and other workers can feel comfortable in sharing concerns that all feed into continuous quality improvement efforts. While it may not be as much of a concern in smaller agencies, proverbial silos and barriers between departments or organizational units can be problematic given redundancies, errors, waste, and delays in navigating between these various organizational units. Remember the first point about having a shared and unifying purpose? Ensuring all entities within an organization share the same purpose, direction, and commitment to quality and improvement is vital to maintaining an effective quality improvement program. Remember that quality issues are routinely related to a system problem, not an employee or personnel issue. If that is the case, then trying to push individuals to maintain zero defects or high productivity can be an issue, as such euphemisms fail to recognize the system component in maintaining quality, productivity, and efficiency. Along somewhat similar lines, work production standards and rates often undermine the team philosophy needed to ensure quality by placing the focus on the individual worker rather than the system as a whole. The argument is that improvement efforts that focus on the processes and systems, not the individual workers, will yield higher production as quality across the system improves. The added benefit is that quality built into the system itself can survive employee turnover as well. Focus your efforts on the employee and you will find quality fluctuating as employees leave and new people join the organization and need to be brought up to speed. Focus the efforts on the system, however, and new employees should be able to acclimate to the system without a significant impact to the underlying quality within the system. At the end of the day, while quality improvement efforts need to focus on the underlying systems, EMS cannot function without its workforce. EMS providers are the lifeblood of any EMS organization, and they must be treated with dignity and respect. Ensuring workers are proud of their work and are respected as individuals and professionals can go a long way in implementing changes to improve quality within any organization. Management and labor must strive for the same goals and work together to make them happen. Job responsibilities and performance standards must be clearly communicated and understood. Management must also ensure the workforce has the tools and information necessary to do their jobs. It was already mentioned in earlier modules that EMS is a profession that requires lifelong learning. EMS needs not just good people, but a workforce that learns, grows, and evolves through education and experience. Effective leadership in organizations that maintain a culture of quality ensure ample opportunities for the workforce to participate in ongoing education and self-improvement. Lastly, quality improvement within an EMS organization requires everyone to participate in quality improvement efforts. This includes people throughout all levels of the organization, along with customers and stakeholders. So what does this mean to you as a paramedic student? Given that evaluating and improving quality within an organization is the subject of entire college-level courses and programs of study, we will not delve too deeply into principles of quality management and improvement within this paramedic program module. WCTC even offers a full standalone quality management course within its online EMS Leadership and Management program. Any EMS provider interested in learning more about quality within the workplace is encouraged to seek out additional educational offerings on the subject. As far as the paramedic student is concerned, quality improvement is important because the paramedic is an integral part of any EMS agency's quality improvement process. Paramedics are practicing medicine in the field and can provide valuable input on system issues that should be the focus of a quality improvement initiative. Ultimately, quality impacts not only the patients served by the paramedic, but quality initiatives can also directly impact the workplace in which the paramedic functions. Near misreporting, for example, can be an important quality improvement activity that helps the EMS agency improve the workplace and possibly mitigate hazards for workers before an injury actually occurs. Paramedics must be familiar with the policies and procedures in place within their own organizations that govern quality improvement initiatives. Beyond the desire to improve outcomes for patients while improving the workplace for EMS providers, Wisconsin Administrative Rule DHS 110.34 sub 14 also requires EMS agencies to maintain a quality assurance program that provides continuous education and assures continuing competency of EMS personnel. Each EMS agency is also required by DHS 110.47 sub 4 to have a quality assurance designee who is responsible for managing patient-based quality improvement processes in collaboration with the service medical director, who is also required under DHS 110.49 sub 2E to establish, participate in, and ensure the continuing implementation of a quality assurance program as part of a patient care improvement process. As mentioned previously in this presentation, NHTSA produced a document titled A Leadership Guide to Quality Improvement for Emergency Medical Services Systems and makes it available for free on its website at the URL listed here on this slide. While the document is somewhat dated, having been authored in 1997, the concepts are still valid and the document should have tremendous value for any EMS agency looking to develop or implement a quality improvement program. If you have the opportunity, please take a moment to review the document and its contents for more information related to quality improvement in EMS. That brings us to the end of this relatively short module. If you are interested in the topic of quality within EMS, you are encouraged to seek additional information through other resources, such as WCTC's online EMS Quality Management and Research course. Given completion of this module, you should now be able to define quality improvement in the EMS environment and describe the contribution of continuous quality improvement to EMS. This presentation was prepared by Waukesha County Technical College in Pewaukee, Wisconsin, and is distributed with an Attribution Non-Commercial Share-alike 4.0 International Creative Commons license. Copyright 2018 Waukesha County Technical College. For information on WCTC's numerous fire and EMS educational offerings, please visit us online at wctc.edu.